Well, as we make our way through this pandemic, we continue to learn more and more about the coronavirus and how it interacts with the human body. A major discussion point this year has been about quarantining or isolating after a positive test or COVID exposure. For a majority of the year, a 2-week quarantine has been advised, but now more research has led to an exception to that. Central District Health here in Idaho is among those nationwide that are supporting the new guidance, which cuts down on the quarantine period in specific cases. Joe Parris spoke with CDH about the new guidance as well as their uphill battle to contact trace.
Central District Health is now endorsing new guidance to reduce the isolation period for people exposed to a positive COVID test but are not showing any symptoms. Previously, people were asked to quarantine for 14 days.
You can go now 10 days if you're asymptomatic, and if you haven't had any signs or symptoms, anything congruent with illness, you feel fine, haven't had anything, you've been monitoring, you've been wearing a mask, you've been doing everything you need to do, you can be outside of that quarantine at the end of 10 days.
Brandon Atkins with Central District Health says there is now a 7-day window for people with no symptoms to clear quarantine. That's for those who have gotten a negative PCR test and are showing no symptoms in that time frame. Tests need to be taken no earlier than 5 days after exposure. But Atkins says that right now, the 7-day method is just not realistic for everyone.
We don't have enough testing going on right now for asymptomatic carriage that would really be as effective for individuals. So really, Central District Health's primary focus would be on that non-testing strategy, which requires that 10-day quarantine for asymptomatics only. If you're symptomatic, you don't fall into this category. The isolation and quarantine does not alleviate. You can't go in and get tested and be released from quarantine early. You have 10 days beyond the earliest onset of symptoms to be cleared from quarantine after you have positive symptoms or a test.
With collective COVID fatigue, medical providers have found some people are reluctant to admit they are experiencing COVID symptoms, or they decide on their own that symptoms can be attributed to something else. Atkins says you should be looking for specific symptoms, especially after a COVID exposure.
If you've got a cough, if you've got the runny nose, dripping, typical symptoms that are associated with it, if you don't have taste or smell associated with it, you're having those body aches, night sweats, those are all things that definitely categorize you as symptomatic.
Contact tracing has been a major tool to find the virus's path and to notify those who've been exposed and need to quarantine. Atkins says that tool is simply not as potent now in Central District's health region because of the high rate of spread.
If we see over 600 new cases a day, it's impossible for our team to keep up with that type of workload. We have to be closer. I mean, when we were pounding out and seeing 200 cases a day, our epi team felt pretty comfortable. 150, 200 was really pushing that max a day, but they were keeping up pretty well with a lot of the contact tracing. We've been over that for weeks now.
So why the change to the guidance now? Atkins says it's with the hope that people will follow a more manageable quarantine.
The 2 weeks is quite a long time, and so anything that we can do to have people become more compliant, as Governor Little would say, with measures that are being offered, then we will be in a better situation to make sure people are truly following those guidelines rather than just saying, well, I'm not going to do it. I'm just not going to follow that guideline. It doesn't make any sense. I don't need to do it. I feel fine.
Well, Joe, contact tracing is a key to a lot of this. And is it an issue outside of CDH as well?
Yeah, CDH isn't unique in that fact, Brian. With areas with such high community spread, it becomes nearly impossible just to track and trace all the different cases. So really what you're watching this epidemiologist teams do across Idaho and the United States is focus on really high intensity level areas like nursing homes, long-term care facilities, to make sure that those areas are tracked properly.
It's kind of why they say just keep your distance from everybody, wear a mask if you have to go out. But again, just kind of stay away, as far away from people outside your house as possible. All right, thank you, Joe.